Menarini Group. Please all welcome for the opening remarks, Ms. Cha Morales, our Senior Brand Manager.
Yay! Happy morning to everyone, especially to our friends in media. So we're very delighted to have you here in LUMINISCE Clinic, and we're also very honored to have partnered with Dr. Kaycee of LUMINISCE, especially for real-life brands. So it's been 5 months since we launched Happy Lift and Skin Fill in the country, and we're very busy, partnering with all doctors like Dr. Kaycee, training them, in order to have this very standard and really high quality of training for our products. So I will not preempt the discussion for later. So I'd just like to, of course, again, welcome you all to this very wonderful event. This is the first time we're doing actually a bloggers event for Happy Lift. So we're very happy to have partnered with Dr. Kaycee. So again, welcome everyone. Hope you'll have a good time today, and again, have a good morning.
All right. Thank you very much once again, ladies and gentlemen, Ms. Cha Morales of Real Life Menarini. Of course, this event, just to talk about more about what Ms. Cha mentioned, we're actually officially launching this partnership with LUMINISCE Clinic and of course the Menarini Group. Of course, we all know that the Menarini Group is actually the leading Italian pharmaceutical group in the world, and the top products that we're actually launching today is of course the Happy Lift suspension threads. We're actually going to give highlight to that later on, and of course the Skin Fill hyaluronic acid fillers, or just Skin Fill fillers. Okay, medyo mahaba yung sounds very medical yung hyaluronic acid fillers. All right, now I can see that you've already served lunch. How's lunch, everybody? You enjoyed it? Okay, great. So we move on, of course, to the highlight of today's event. We're gonna have a different perspective. Okay, first from the clinical side, from the clinical perspective, and of course from the patient side, just to talk more about these procedures. Of course, the Happy Lift suspension threads. So we'll go to that, we'll go to the panel discussion, and of course we'll welcome the floor later on for your questions. All right, without further ado, ladies and gentlemen, I present to you, of course, from the LUMINISCE Clinic. Please give a round of applause for Dr. Kaycee Reyes, looking very lovely and wonderful on this Tuesday morning. And of course, our blogger friends, please also give a warm welcome to Alishan Calaor and Lace Leonora.
I just wanted to introduce myself. So I'm Dr. Kaycee Reyes. I'm the founder of LUMINISCE Clinic. We've been here since 2012. So I studied and trained in London in St. John Institute of Dermatology. And then after that, I went to National Skin Center in Singapore to train aesthetics and laser surgery. Then I went to different parts of the world. Like now I'm doing anti-aging medicine in Germany, in Dresden University. But I really like doing aesthetics. I mean, I'm also an artist, but I do that to the patient. Because when you do the face of the patient, it's not that you should only not know how to operate, how to cut. You should know what will make your patient more beautiful. So you should know how to assess the patient, what the patient needs, how the patient age, and the patient's anatomy, because anatomy varies in each patient. So I'm going to give you a brief story about the my Happy Lift journey with Menarini. So this is Happy Lift. My disclosure, I'm an Allergan's Philippine Advisory Board member and trainer, and now I'm a Happy Lift injector trainer. So usually we view female to be attractive if the female has a raised thin eyebrow, wider eyes, prominent or high cheekbones, deep fullness, and shorter or narrower lower jaw. For male, we view it if the patient or if the male patient has a more horizontal and bushy eyebrows, and also a narrow nose and a very good jawline. But right now, the Korean trend, we have the Korean trend of female boys, diba? They want the oval thing for the Korean. Yeah, it's the new trend. But right now in Manila, in the Philippines, men still prefer this. So we inject hyaluronic acid, like Skin Fill, in this area, just to make the jaw more more square. So it can be done. But for some patient, they want the V shape, we can inject Botox or Dysport to the masseter to make it more V shape. We can do everything today.
Nothing that science can't do
Yeah.
now these days.
So, for Asians, they want a clear, youthful, fair skin and a smooth oval facial shape. Also, they want an anterior projection of the mid-face. Usually, we fix the nose and the chin and the lips and the forehead. Mostly Koreans, they like fixing the forehead because it make them look more feminine and younger. But the Koreans, you see, it's more protruding forehead. We also do that. We can do that. But for some Koreans, they inject at least like 5 to 10 cc of fillers na medyo hindi na siya ganun kaganda. So we just want subtlety. So beauty trends in Asia, for older patients, we like brow lift, overall wrinkle reduction, tear trough, nasolabial, and marionette fold softening. So we can do this with the LUMINISCE product, with a happy lift, and also with a soft fill. So, di ba when I work side by side with the makeup artist because I study how they do the shading. Because as we age, when we're young, when you see a baby, di ba? The baby para siyang nag-glow. Because the face of the baby hindi pa nag-evolve yung bone niya, hindi pa nag-resorb yung bone. So as we age, we lose the light reflecting properties of our face. So these are the light reflecting properties of the face. This is the inner forehead, and then the medial cheeks, and also in this one. As we age, the bone here, it resorbs, it goes down, it gets destroyed. And then what happens, the face is divided into different fat compartments. In each fat compartment, they age differently. So the bone, hello, hello, we're just doing the discussion. So for the face is the bone. There's a bone, and just above the bone, there's a deep fat pad. The deep fat pad, as we age, it gets resorbed. So it gets down and it becomes atrophic. It meaning nawawala yung laman. And then after that, there's a muscle, and above the muscle are ligaments, and then subcutaneous tissue, and then the fat pads, which are superficial, yun yung mga fat pads sa taas, and then the skin. So what we do, we target with Happy Lift, what we do, we target the superficial fat pads, yung sa taas. Kasi yun yung bumabagsak as we age, wala siyang support from the bone, unlike the deep fat pads. So the magic of highlighting is we tend to highlight the light reflecting properties of the face. So, and then also, for this patient, she's very young. She still looks good even without makeup. But you know, when we do makeup, we can hide the look of tiredness, the look of sagginess. So that's why with the injectables like soft fills and then Happy Lift, we can recreate the makeup look. It can be done nowadays. So facial aging, this is what I was telling a while ago. The bone here, like there's a drooping eyebrow, because the bone here, it get resorbs, and then the fat here, it goes down as the bone get resorbs. So you see the downward ptosis of the fat and also the bone. Also the tear trough, it becomes more prominent, and there's a sunken temporal region, and you see the nasojugal fold. This one, you see there's a ligament attached from the skin to the muscle, and we lose the volume here, the fat here, so it becomes more prominent as we age. And then this is the nasolabial fold, and you see the mid-face sagging, and also there's a sagging jowls. This is the jowls, because the fat here, it's situated here, but as we age, the ligament, it becomes lax, so it goes down. So you can see the jowling here. And also you can see the marionette line. And the chin, as we age, it becomes everted. So that's why there's a receding chin. That's why when we put fillers, like soft fill on the chin, you will become younger. Parang most patients, they want to correct just the cheeks. They tend to forget the chin. But if you put on the chin, yeah, you will look younger and more attractive. For males, yeah, although we don't see the sagging lids and the sunken lower mid face in this patient, he's one of our patients. He's a very, very nice person. He's sorry. So these are the usual concerns for males. And for females, she's also one of our skin investors, Miss Maggie Wilson. Although she doesn't have this, but we just want to point the anatomy of the usual concerns of the patient. This is the aging process that I was telling you about. So it doesn't only begin on the skin, because most people, when they go to the clinic, the main concern is the skin. But you know, it's just not the skin. The skin, when we age, the pores, they become bigger. We develop pigmentation. We develop fine lines, wrinkles, and vessels. But actually, it's not only the skin. If we do something on the bone, we can recreate the facial features that we have when we were 60 years old. But it requires maintenance. It's not just a one-time, big-time treatment. So the use of thread. So it's an aesthetic procedure that leaves and realigns sagging tissue while adding definition to facial contours. So for me, this is the next best thing to surgical facelift. I also do surgical facelift. So I use permanent threads to get the fat here, the smash here, and then suture it here. I also do that. But I do that to patient. I choose my patient well, because the patient, if they have high expectation or if they really have severe sagging, we cannot just use Othera, we cannot just use lasers, or we cannot just use injectables. If they start late, I mean, the patient goes here at the age of 70 and they want a lifted face. I mean, we can do that with fillers and Happy Lift, but he needs to pay twice the amount because the product are expensive. This product, that's why it's expensive, because they're made of good quality products. They're not just the cheap products that we can get from China. So it's different. That's what, like for me, it's not just my hands. It's not just how the injector is knowledgeable. It's also the quality of the product. You need to ensure that you're using a very good product, because if you don't use a good product, it will not really change the face of the patient, even if you have good hands. So Happy Lift, what's the difference of Happy Lift with other fillers? Happy Lift is made of polylactic acid and caprolactone. So the caprolactone, it gives the resistance to the thread, so it will lessen the breakage of the thread. The polylactic acid naman, it helps with the elasticity of the thread. So compared to other threads, this two, it promotes formation of type 1 and type 3 collagen. So kaya mas matagal siya compared to other threads. Like the usual threads that you will see in the market is polylactic acid alone or PDO threads. These threads, they're really good too, pero compared to caprolactone and polylactic acid combined, it will last only for 6 months, and then after, it's not as long lasting as this one.
Doc, sorry, how about versus the surgical facelift? How does it differ exactly?
Yeah, I'll drink first.
Before she gets to that question.
With surgical facelift kasi, it's a permanent thread. So, for it really depends on the patient selection. We usually do surgical facelift to patients who have severe signs of aging.
Okay.
So we use a we open the skin here, here up to here, then we open the skin, And when we go to the smash layer and we get the smash here and then suture it here.
Okay.
And then we get the smash here and then suture it here to lift the face. So that's permanent.
Yes.
Mas drastic yung effect niya. You will see instant lifting. Kasi you will suture.
Yes.
You will get the ligament underneath the bone. Dun mo i-anchor. So you will see instant effect. With this one, it will not melt. It will be there na for like in a lifetime na. But this one kasi nare-resorb siya ng body natin. So it will last for this kind of trend 15 to 16 months.
Okay.
But the effect is up to 2 to 5 years. So what happens kasi like for patient selection, if we're going to do surgical facelift for patient who are young, like around for patient that we did, like Miss Reyes is so young. She's only in her early 30s. Pero we saw drastic effect now with the happy lift. But if we do surgical facelift, hindi siya ganun.
Hindi ganun.
Super pangit.
Iba.
Kasi it really depends on the patient selection. Kasi we use happy lift for patients who have a mild to moderate sagging, and we have when you can see the signs of aging na ng konti, but not as much as talagang baksak. And you will see na meron pang bumabasok dito yung fat. Hindi katulad ng iba na baksak na talaga, hindi na yun kaya ng happy lift. Kasi with surgical facelift, hindi you need to redo it after 10 years. Just in case the patient, it depends on the quality of the work. Kapag hindi masyadong maganda, babaksak uli siya after 5 to 10 years. Or 10 to 15. Kailangan mo ulitin. Usually, nagre-repeat sila 10 to 15 years eh. What's good with happy lift, if you do this, you'll put it on the right layer, dapat sa magandang layer, para itaas niya yung totic fat pads, itataas niya yun, ililift niya. So, because of the barbs, it will lift up the fat pads, and then yun na yung mechanical property niya for lifting. And then after 12 to 15 months, it will last for 12 to 15 months, nakataas na siya. But after that, wala na yung mechanical properties niya ng lifting. Pero makikita mo pa yung lifting niya kasi nagde-develop siya ng capsule, fibrotic reaction around the thread. So that fibrotic reaction, that's a fibrotic scarring reaction that will lift the face. Pag nag-develop ng fibrosis, mag-stimulate ng collagen remodeling, hyaluronic acid formation. So it's really good. So yung kaya yung effect niya, it will last for 2 to 5 years. Because yun na yung second option. Pero that's why compared to other threads, like before, Aptos threads is non-surgical threads. Non-surgical threads na we use, pero hindi siya na-resorb. It's permanent. Pero after 12 to 15 months, nandun pa rin siya. I mean, why would you choose to have something permanent in your face? Diba? Why would you choose something permanent in your face kung wala na yung effect niya, diba? So, you only do that with severe cases.
Alright.
So, this one, dalawa yung effect niya, the mechanical properties, which last for 12 to 15 months, and after 15 months, there's a new formation, hyaluronic acid, which will help lift the face. So, may studies na about this. Meron na sa microscopic, you will see the creation of the fibrosis and the new hyaluronic acid. So, that's the effect. But compared to other threads, like for example, the monofilament threads that you get from Koreans, there are mga, I won't mention names, there are Korean threads na monofilament na no barbs. So the different type of quality of the product, hindi siya combination of these two. So it will last for a less amount of time, so around 6 months. And then at the same time, they don't have barbs or cogs, which will lift the malar fat pads. So, minsan, may tendency mag-slide. So, makita nyo when you do the threads, especially, I started doing threads since 2012. I really didn't like the monofilament threads. Kasi when you do it, you don't see any effect. You don't see lifting. And the patient will pay around 80 to 120,000 for that. Kaya naman sa patient. So, that's why I only endorse with products. For me, with that, I can see effect with happy lift. But with other threads, no, wala.
Don't be happy lift. After 3 years, you have to be quick na.
Most of the time, I tell my patient, better kasi it's not just happy lift. For me, it's the synergist synergism with other products.
Yeah.
Like you do laser devices or like
So maintenance.
high intense food.
On the side.
It really depends on your lifestyle also. Kasi when you smoke, when you sleep late, when you're stressed, mas mabilis siyang mura. Even the skin feel, the injectables.
Okay.
So it's kasi nga, I have lots of patients who are athletes, who are very healthy, but they still go here because they need to fix the face. Because yun nga, lagi kong sinasabi, even if you eat healthily, even if you exercise regularly, the face will change it. That's why
Over time, yeah.
Over time. That's why you need this, especially if the genes. If the genes, if you don't have that good genes, like me, it's nice that I have this clinic. I utilize every equipment, but yun nga, I do something environmentally, like the environment, para to make it better. I mean, if I don't have the genes, diba? I have patients, they just start to complain at the age of 42 and 52 because they have good genes. But they didn't start with taking care of their skin, diba? I mean, dapat sana sabay. Not only genetically, but also environmentally.
Alright. Doc, if we could kindly also call one of your patients who underwent the Happy Skin Tread Lift. Once again, we'd like to call on Miss Lace, Leonora of mommylace.com. Please give a round of applause to Lace. And of course, also Miss Lishen Kalaor, please. If you could also join our panel, please. Thank you. Thank you so much. So we were just talking about the procedure. Of course, Doc Kaycee already shared a lot about the Happy Lift. But Doc, you've mentioned about the price. Now, of course, this is a quality product, of course, from Menarini. But if we could kindly, just a very rough estimate of how much does this procedure
I
cost.
also did pala Happy Lift. So this was 6 months already.
Oh, very nice.
Maganda siya. And, diba? You're happy naman. I'm happy.
Happy with Happy Lift, right?
So the price of Happy
Yes, ma'am.
Lift, it really depends on the doctor. Siyempre, the doctors, it's not an easy procedure.
Correct.
I mean, it cannot be done by just any doctor because it has complications. I mean, even in good hands, when you have a different anatomy, you can have complications.
It's a case-to-case basis, right?
The best is to know how to handle the complications because if you don't know, pwede siya mag-aggravate. Then it can lead to certain complications na I won't mention for now. So the cost
Disclaimer,
around
right?
60,000
Okay.
to 120,000.
All right.
And that will last for 2 to 5 years. It really depends on the severity and how the patient take care of herself.
Maintenance, right? Of course. All right. So after the procedure, Doc, are there any restrictions? Of course, we all know when you underwent any, clinical procedure, are there like any restrictions or, you have to stay away from anything?
I was a rebel. When the doctors,
Yes.
of course, you're required to rest out the next 3 days. But of course, as a vlogger and a mommy,
Yeah.
you really can't, just stop your world just because you got a procedure. So what I did was just minimally try to minimize my daily activities.
Alright.
But I still attended events. I still went to the grocery. It was
Okay, you're
typical.
on the go, right?
The main thing that I and even Dr. said that I should take paracetamol or mefenamic. I didn't because the pain was completely like it's there, but it's not like it's gonna be tough for you to move around. So I was I'm gonna do everything that Dr. said not to do. But no, but but sinabi niya kasi in a sense that you can do this, you should sit, but you know what, I don't, parang sinasabi naman niya is, you can still do your daily activities, but of course, recommended is to rest. So if you could rest, then go ahead. You could probably, but if you really can't, don't worry, it's not gonna do anything.
Okay.
Kasi 2 weeks.
Yeah.
2 weeks. 2 weeks, the effects lasted, right?
Yeah.
Okay.
So, like Shen, I'm also a mom. So, after Happy Lift, I was immediately able to resume to my work, my daily activities. The only restriction is not being able to work out for 2
Yeah, I
weeks.
think that's the only thing, but that's not my problem. That's why I got Happy Lift. Yeah, so I think that's it. But you can definitely take care of your baby. I have a 6-month-old, so I just made sure that she didn't want to grab my face.
Yes, yes.
But even when she was able to like pat me on the it
Didn't hurt.
It didn't hurt that much. Yeah. There was pain, of course. I mean, may pinasok siya.
Yes,
but it's not like first 3 to 3 days, I think you'll find the parang shocking yung face mo.
Yeah.
Oh, okay.
But you'll want it.
Okay.
Kasi it means your skin is, your body is...
Yes, it's reacting.
It's reacting and it's healing. And then it's soon, parang 4th day lang nagsasubside na siya. And then 5th day, 6th day, people are saying na parang, ano ba yan ka? I was looking for a yaya downstairs at the playground. Tapos mawalan ko ng yaya. This is my last event. Yes, this is my last event. Sabi nung mommy na isa, kaklase nung anak ko, ano nangyari sa'yo? Ba't parang payat mo? I'm like, ewan ko, milk tea? Milk tea? And then sabi ko, ay, pinagawa ko yung face ko, ganyan-ganyan. So, chikahan na kami, talaga, pwede na ba yun sa breastfeeding? Yun na yung mga tanong. Kasi parang kaming may thought.
You were
So, pwede lahat, pwede.
Alright, which brings me to my next question. Parang who would be the good candidate for Happy Lift procedure? Like, she's a mom, you're both moms. Like, are there any restrictions or in terms of age range, Doctora?
Good candidates are 30 to 60 years old.
Okay, 30 to 60 years old. Alright.
Because if you do this to like 70-year-old patient, you will see subtle results.
Okay, because severe na yung cases and
then you
the
will
sagging,
make the patient unhappy because you're not addressing what he wants.
Yes,
so
correct,
it's really how you talk to the patient and get the expectation. What's your expectation and what result do you want?
Do you want to see? That's right.
The patient has really high expectation and has severe sagging. So I can recommend something
else other than this, right?
Na he would be happy. But this one, the best is this kind of like age range.
Our age group.
Group with mild to moderate sagging, and we have good skin, or we have a hypertrophic or medyo malaki yung fat here na we can lift. Kasi some patients, they have like wala na talagang fat, bagsak na talaga. Those patients, they require skin fill, which is a different procedure altogether, right? Just to volumize. This one is for lifting. The best is combination treatment.
Oh, okay. So you can actually do both. If kulang yung fat mo sa face. Okay. So can you do that at the same time? All right. So first, I'd like to ask Miss Lay. So why did you want to try the procedure? Because Doctora mentioned about the effects that you wanted to see. So in terms of your lovely, pretty face now, but before undergoing the procedure, what did you want to see?
Even though I work out, even though I eat healthy, I still see mild sagging dito sa jawline. So my jawline was starting to disappear no matter how much I work out. So I started to consult with Doc Kaycee what I can do. And then fortunately, by that time of my consultation, Happy Lift product is already
available.
So, that's why I got Happy Lift, and also my smile in my mouth was starting to become downturned. So, parang naka-frown siya. So, you look sad, angry, and sad. Even if
you're happy, diba?
And I have an 8-year-old son. I always want him to think that I'm very happy. And I also like going out with dates with my husband. So,
where is that aforementioned husband?
So, after Happy Lift, I'm more confident. It boosted my motivation in life. And of course, in our age, if you're early 30s or whatever age you are, as a woman, you want to get the most out of life.
Correct.
So, having a good doctor with the right product is very good.
All right, very well said. Thank you. This time, we'd like to hear from Miss Lishan. Same question.
Non-unbeknownst to anybody, she already did my nose 2 years. Last year, yeah. So almost 2 years. So when I did the tread lift with her, and then she mentioned me na meron siyang mabagsak. Happy Lift. Nung siyagi na sabi niya, we have a new product and ganyan. And we've already been talking about my face na before. So I know na yung kung saan na siya.
The needs.
Yeah, I wouldn't say need really, but it's, the things that you wanna give yourself. Mga ganon, yung mga nasa Christmas wish list mo. So parang yung sinabi niya, may bagong product, may Happy Lift. I'm like, okay, So walang questions asked because I know my face, I know what it wants. So I wanted to give that to myself. And as a beauty blogger, in a sense, like I really want to try what's everything out there, so other people have an idea what they're into or what they're getting into or what parang sino na bang naka-experience na. So I really wanted to be one of those people na to try it first and then tell my story, and I have nothing but good things to say. Yun. And then ano ba? Parang walang I'm not that type of person but na scared with treatments. And Dr. Kaycee and I were talking, it's like it's really important to start now rather than when you go to your 60s and dun ka, and then people will say, you got a surgery, you got a surgery. So at least now, parang people are like, when I turn 30, magpo-40 ako, people are like not gonna like, oh, may pinagawa ka. Kasi parang I'm just maintaining my look. Diba? Letting the other things go, but you know, just maintaining the rest of the things upward. So by 40, I still look the same. By 50, I still look the same. By 60, I won't probably need as much surgery. So, but yeah, it's really a good gift to yourself, especially if you're feeling like you need a revamp or a new lease in life.
It's an investment.
Yes, treat yourself very greatly. And finally, as final words from these beautiful ladies in front, would you recommend Happy Lift? Of course, I'm sure that's a resounding yes, but why exactly would you recommend it to anybody? Because Miss Lishan right here, she's not like everybody. Sabi niya kasi, she's not afraid to try, to explore, but not everyone is like that. So how would you, exactly convince those that would want to try at this age, but, are skeptical about this, or, afraid or hesitant trying these kinds of procedures? Doc, let's start with you.
Yeah, because I'm a doctor and I'm results oriented. That's why, I just want to see results. That's why I'm recommending Happy Lift.
All right.
With my friends and with my fellow bloggers, writers, journalists, I think the number one concern is that they're scared of complications. So I think the first thing that you must do is research, find a certified doctor who is accredited to provide the Happy Lift treatment, have a one-on-one consult, talk about the risks, and with Happy Lift, the risks are very minimal. You can resume your work, whatever, right away. So it's a minimally invasive procedure, unlike major surgeries. So it's very important to find a good doctor at the right clinic. And also, when my Happy Lift was being done, Doc Kaycee had a lot of support from the nurses here, which made the procedure so much more comfortable. I'm not sure how other clinics will do it, but the nurses here are very caring and very knowledgeable. So it made the process very comfortable, and I was relaxed throughout the procedure and during my healing.
All right. Thank you. And finally, Ms. Lishan.
Liz said it all. That you really need someone who will take care of your skin before and even after. Like when Dr. Kaycee and I were talking, I could already feel the results, and it hasn't happened yet. So I think that boost of that confidence in your doctor is important. And then as the procedure goes along, it's the same. She talks about the products properly, explain to you, because I know a lot of people, they really trust their doctors, and you want your doctor na a lot of people are not like Google online, search all the pictures. No, they go to their doctor and they ask, is it okay for me to do this?
Correct.
And you have to find a doctor who will be honest enough to tell you na yes, kailangan mo yan, and no, hindi mo yan kailangan. And I think that's I think the number one important thing na kailangan meron ka in your doctor, aside from, of course, technique yung na magaling talaga siya dun sa procedure na yan. And I'm happy that Dr. Kaycee chose Happy Lift to bring it here in Luminous, because I really am happy with my face.
All right, great. All right, of course, that's Dr. Kaycee Reyes from Luminous. And of course, I'd also like to call once again from the Menarini group just to talk more about the products that we've launched. Once again, ladies and gentlemen, Ms. Cha Morales. So now we're opening the floor because, if you guys have more questions, ladies, please do so. You can address it to any of these lovely ladies in front. All right. All right, so we have, do we have questions? Yes, ma'am. From? All right, yes, please. Okay.
So sorry.
Yes.
Show my photo.
Yeah. Doc Keys, a question from
Here.
Rockstar Mao.
Complications. The 67%, according to one journal, it's more of a mild bruising, and then 20% is mild erythema. That's redness. But the very rare cases naman, we can have infection. Like if you do the happy lift to patients who has acne or who has rosacea, we have usually acne is because of bacteria, that normal bacteria in the face. So if you do that to patient, it can proliferate the acne bacteria. Also, another complication if it's not if the patient sometimes has varying anatomy. So if you don't study the face, or sometimes even the best of hands, you heat some of the vessels. So when you heat some of the vessels, it can cause hematoma. So when there's hematoma, you get some bruising at the same time bulging. So it can be lessened with putting ice pack for at least 20 to 30 minutes during the procedure, and then after you put warm compress for 1 to 2 days. And that's why you can lessen the complication with proper assessment of the patient, because some patients we cannot do the procedure to some patients, like for patients who are immunocompromised, we have low immunity. We cannot do it for patient who's taking blood thinners, because it can cause bleeding, profuse bleeding. We cannot do it to patients who have a history of keloid. You can cause hypertrophic scars or keloids on the face with the injection technique. You cannot also do the procedure to patients who have immunocompromised, like has cancer or has psoriasis. It really depends, and it should be like diabetes should be controlled diabetes if you want to do it for diabetic patients. And then for this one, we don't do that to pregnant patients in breastfeeding, but for patients who are adamant, like pregnant patient. I have one pregnant patient who was really so hard. He kept coming back here like every day for 7 days.
Wow. And persistent.
Yeah, and I know her OB, one of the head of OB-GYN here in St. Luke's. And she made him call to me to do the procedure.
To endorse her.
Yeah.
Right.
Okay, and then I said yes. It's less than 6 months naman kasi usually I don't do infection pag 6 months and above because it can cause contraction. But I don't usually do it to pregnant women, because if something happens, they will sue me.
Definitely. And we'll go back to you, Dr. I mean, let's be honest, right?
Yes. And then, like for Shen, we did it to her breastfeeding. I just asked her to dump after the procedure. We need to dump the first the breast milk, kasi we injected lidocaine to the area of injection, just to make sure that it will not go to the breast.
To the breast, yes.
And then other complications. Actually, other complication is if you don't use sterile technique, it can cause infection. And if it's not done properly, you can see the thread to the skin. If it's done superficially, you can see the thread. And sometimes, if the thread can extrude on the skin, it can happen. That happens like 4% of the time. So it's how you manage complication, because it can happen. So, but most of the time, in the best of hands, if you know not what to do, how to prevent it, it will not happen. But sometimes it happens. It's just that you should know how to manage the complication. It's very important.
All right, so that answers your question, ma'am. Thank you. So we'll take some more questions, maybe 2 or 3 more. Yes, ma'am.
Right a while ago, you differentiated facelift and happy lift.
Yes.
So like, how would you differentiate it from something like Ulthera?
I love Ulthera. Ako,
like, when would you recommend?
I would recommend both.
What are the main differences?
The Ulthera kasi, it's a high-intense focus ultrasound. It can go very deep, 4 to 5 millimeter deep, to the SMAS layer, to target the SMAS, to stimulate the SMAS to lift. So there's a gentle lifting of the face. So what I do, I tell the patient to do Ulthera first, or Thermage, and then after a month, or after 1 to 3 months, they do the fillers, or the hyaluronic acid, or the thread lift. Kasi like, we usually start with Ulthera late 20s, or early 30s, and you do that once a year. Thermage naman is also a good machine. It's a radio frequency. It's more for skin tightening. So it's not as deep as Ulthera, but it's really good, a good machine to form fibrosis, to cause tightening and contouring of the face. So what I do combination.
You can do combination,
so
right?
you will see.
Pwede siya right after the
I know, not right after. At least 1 month.
Okay.
Some patient, some doctors who are very conservative, they do it 3 months after. But some patients most of my patients are impatient.
I like that. Impatient patients.
So, yun lang yung mahirap kasi mas laki yung chances ng complication.
Yes, in as much as you want to do it already, right? But of course, you have to wait, right?
You have to have a plan for the patient.
Correct. Alright.
have the same purpose, V-shape, contour.
No. Actually, it depends on the concern of the patient. But the secondary effect of Ulthera is fat reduction. It's just the secondary effect. Primary effect is the lifting. But for the happy lift, actually with Shen and with there's a mild ptosis na here, like in my case baksak, kaya maganda din siya. Kaya makikita mo mababawasan yun, magiging V ng
Magiging
konti.
V, right.
For some patient who are very young, I did it to one patient who is young. She wants a V-shaped face. Okay naman siya, naging V-shaped yung face niya.
Interesting.
That's a 27-year-old.
Alright.
Question.
Yes, sir.
For Minarine.
For a male, yeah. This time for a male. Okay.
How do you choose? What are the process of finding and looking and evaluating the best doctors to represent or utilize your product?
That's a good question, right?
Yeah, that's a good question. So, yes, actually we do a lot of, not really screening, but really make sure that a doctor is of course certified, either dermatologist, plastic surgeon, cosmetic surgeon, and also does aesthetics. So it's like Dr. Kaycee, she has her background in dermatology and also cosmetic surgery also. So, and even after that screening, we also train them. So they undergo 2 modules actually. First is the basic training for happy lift threads, and then they do another advanced technique training to really ensure that they are trained on the basic standard techniques for happy lift.
Just to add also,
Yes, ma'am.
just to add to that, Menarini, as you've said, being the #1 pharmaceutical company in Italy, always advocates to the welfare of the patient before business. It's always like that. So we made sure, just like what you asked earlier about the complications, we made sure that we don't sell the product for those doctors who were not trained at all for happy lift, because we know that it requires teaching skills for the doctors, and it requires also techniques. And as Dr. Kaycee would have said, it's not just the hands, but the patient assessment is also very crucial in choosing the procedure fit for the patient to be able to get the right result.
Yeah, so
that's
there are many
the
factors
advocacy.
involved, right?
Exactly.
Thank you, madam. What's your name?
I'm Riza.
Ms. Riza from Menarini, of course. Thank you. All right. So, any more questions?
Just
from
curious,
the
how
group?
long is
Yes,
the procedure?
Okay.
Most of the time, it's around 40 minutes. If the
40.
patient would ask for
Fast,
topical
ah.
anesthesia. But for patient, once was limited time, so we can do the procedure even without topical anesthesia. We just inject anesthesia to the face.
Wow.
And then, after injection, we do the thread.
Those are the
Around 30
impatient
minutes.
patients, though.
That fast.
I think that's the only thing that I would say na painful in the procedure.
the anesthesia. Yes.
Lang. Kasi syempre wala pong anesthetic yung
Correct.
inject. So pag-inject inject on the points that they need. Yun na, tapos na. Like, after that, parang, okay. So, I was even facing the mirror.
Okay.
Where there's a video of that. So, if you want
Can you actually show that?
There's a video. It's like, I was looking at the face. Parang sabi ni Doc, ano ba talaga, no? I'm like, Doc, kasi wala akong nararamdaman eh. So, it's a different person I'm seeing altogether.
Oo, kasi parang ginagawa ko siya sa share, tapos may mirror sa harap. So,
Nakikita talaga, no?
So,
Alright.
ako nun, parang sa vlog, kasi like, talaga, ang galing, parang I feel like a doll. Very expensive
Italian
doll.
Italian doll. Right. Menarini
And
doll.
I thought it would be super, super painful when the anesthesia wears off. Wala, parang maga lang talaga siya. Parang may peke, yun lang. Tapos after that, wala talagang pain. So I was really surprised. So, and I think, and my tita said, talaga it says a lot. Dun sa treatment ng doctor.
That's true. With the very able hands of Doc Kaycee, of course.
Kasi my tita is a surgeon. So parang sabi niya, pag wala ka masyado na, even giving birth, pag wala ka masyado naramdaman with your ibig sabihin maganda yung doctor.
Right. Which brings us, of course.
That made my day.
Nako, Doc, lahat kami dito, nandito na sa harap ng asking for consultation schedule. Right. Oo, fully booked na right after. Mas magiging busy pa. Okay, thank you so much for your questions. Any more? We'll maybe take just one more if you guys have any. We're good? We're good? All right, ladies and gentlemen, once again, Doc Kaycee of Luminous Clinic, of course, Ms. Cha Morales of Menarini Group, and of course, our blogger friends, Lishan and Lace. All right, thank you very much.